Hello, everyone, and thanks for joining us. Welcome to the 2025 American Diabetes Association's Living with Diabetes Ask the Experts series. Today's topic is empowering women through health education, addressing obesity. I'm your host, Susan Weiner. I'm a certified diabetes care and education specialist and a registered dietitian nutritionist. Our Ask the Experts series is all about you and what you'd like to know. So please get your questions ready. Again, today's topic is empowering women through health education, addressing obesity. Please stay with us throughout the entire hour-long event. We're going to be answering different questions, providing tools, resources, strategies, and information. And at the very end of today's event, we'd really appreciate you staying with us for a very brief 6-question, less than 5-minute survey, because your feedback helps to shape future events. So thank you very much for that as well. If you're joining today by phone and you'd like to ask a question, please press *3. That's *3 on your keypad. An operator will collect your question and put you in queue so you'll have the opportunity to ask your question live. If you'd like me to ask the question for you, please just request that. That's great. If you're participating online, please type your name and question into the fields below the streaming player. And remember to hit the submit question button, and your question will come directly to us and I can ask it for you live. Joining today's event is a great step towards taking care of your health. Thank you to Lily for supporting and sponsoring today's Ask the Expert event, as well as the work of the American Diabetes Association to address obesity. Obesity results from a mixture of environmental, behavioral, and genetic factors. This means there are multiple ways to manage it. Please visit diabetes.org/obesity. That's diabetes.org/obesity to learn more. And just a few hours ago, about 2.5 hours ago, the Obesity Association announced the publication of Weight, Stigma, and Bias, Standards of Care in Overweight and Obesity. These recommendations make up just the first part of several chapters to be published as part of the Standards of Care in Overweight and Obesity, which addresses the pervasive stigma individuals with obesity face, which undermines healthcare access, quality, and outcomes. If you'd like to learn more, please go to obesityassociation.org. That's obesityassociation.org to learn more. And please share this information with your healthcare team, your physicians, your healthcare providers, and anyone else who may benefit from these guidelines and resources. It's really an excellent resource. And now I am super excited and delighted to introduce today's excellent guest speaker, Dr. Neela Escaname. Dr. Escaname is a board certified in pediatrics and pediatric endocrinology. She joined UT Health San Antonio faculty in 2017 in pursuit of research interests related to maternal and fetal nutrition, as well as body composition and the epigenetics related to childhood obesity and type 2 diabetes. She was selected as an educational scholar by the Academic Pediatric Association to further career development in medical education and previously served as the medical director of Project Power. Project Power is a diabetes prevention camp that works in conjunction with the American Diabetes Association and other community partners to prevent youth onset of type 2 diabetes. Who better to join us during Women's Health Month? We're so excited that you're here. Let's give a warm welcome to Dr. Escaname. Thank you so much for being here.
Thank you for having me.
Of course, of course. So let's jump right in. Obesity is a significant public health concern for so many people. Are there very specific factors that contribute to obesity in women?
So I wouldn't say it's just any one thing. There are several factors, obviously, that contribute to obesity. Um, I specifically am a pediatric endocrinologist. So in childhood, we really look um, at genetic predispositions. There are certain genetic causes for obesity that are sometimes a single gene that can be altered that can affect our ability to feel satisfied. So satiety issue. Those tend to be diagnosed pretty early on. because they tend to come with other developmental issues. Um, in terms of as we get older, we know that there are hormonal factors that play a role. Usually, if children are suffering with early onset obesity, we always want to screen hormonal factors like their thyroid or issues maybe related to cortisol levels. That also kind of spans into women. So there's different hormonal factors as endocrinologists that we really look into, and then um, as we age, again, I'm not a adult endocrinologist, but just knowing kind of how the life cycle is as we go into menopause. Our hormone levels shift around, so that can kind of predispose us. And then during pregnancy, obviously, there's so many hormonal changes that occur. Weight gain, obviously, that is expected during pregnancy, but then kind of postpartum, a lot of women will retain weight afterwards, especially after multiple pregnancies. That being said, there's a lot of social things that come up into play. There's obviously issues related to access to staying active. I can attest to being a busy mom and, you know, um, busy work life balance, and, just finding the time sometimes is really difficult. So our activity level definitely plays a role. Access to just high calorie food. So oftentimes we're busy and we seek things that are fast and easy. And oftentimes these are really high calorie foods. And then there's also just like cultural things, I come from a family who just loves to celebrate culturally with food. And so I think that's kind of contributed to certain populations being at higher risk, especially in this era of access to high calorie foods now, in addition to just kind of cultural um, kind of relationships with food. And then certain medications really kind of play a role. So there's and just medical conditions that can really increase risk for weight gain. And then as we're learning now more and more the importance of just kind of chronic stress and sleep, those all play a huge role. So there's so many factors. You can't really just
Absolutely.
pinpoint just one thing. But yeah, I think from the lens of seeing it in early childhood, we really kind of um, really want to make sure that we're ruling out like genetic and hormonal causes when we see it in children really early on.
Yeah, those are all fantastic points. It's so multifactorial, all of these causes. And if you're just joining us today, our topic is empowering women through health education, addressing obesity. And as a quick reminder, for those of you who are joining by phone, if you'd like to ask a question and bring them all on, please press *3, that's *3 on your keypad, and an operator will collect your question, put it in a queue, and you'll have the opportunity to ask it live if you'd like. And if you're participating online, please type your name and question into the fields below the streaming player. Remember to hit the submit question button. And again, let's focus our questions on empowering women through health education, addressing obesity, or any questions that you have around the topic. And I actually have a first question to kick this off with everything that you were discussing, because I know that there are going to be a number of questions about this, as there always are on Ask the Expert, around obesity. And coming from children into adulthood, do you see a connection between PCOS, type 2 diabetes, and weight management in young adults and adults in women?
Yes, absolutely. I know we see a number of children with polycystic ovarian syndrome, and there is uh, correlation with insulin resistance and obesity, as well as risk for irregular menstrual cycles. And so, not all women that have PCOS necessarily will have obesity as a risk factor, but they definitely tend to be hand in hand. So, we know that there's definitely a risk with the with high insulin levels to develop hormonal imbalances that will lead to also irregular cycles.
So, and expanding on that, we have a question coming in from Karen, who submitted a question online, and she's asking, and because we kicked off that topic, we always get a lot of questions about that. What is insulin resistance? What does that mean? And what does that mean in the context of treating overweight or obesity in people as they become adults, through adolescents, adults, and for older adults? What does insulin resistance mean?
So the way I tend to explain it to families is, we're all designed to make insulin to help regulate our blood sugars, but there tends to be a genetic, again, usually a genetic predisposition to insulin resistance where your insulin just is not really working the way that it should. It's kind of gotten used to having to try to regulate the blood sugar so often that the way I explain it is that, insulin is a key that helps blood sugar regulate its entry into the body, like into blood cells, into fat cells, into because we use glucose, sugar as our main source of fuel. So when you develop insulin resistance, is that you have a bunch of keys. There's plenty of insulin, but they just aren't working the way they should. Either it's damaged or it's and it might not actually be just structurally like the insulin is not. It's just that the body's developed kind of a resistance to way it's working and how it responds. In terms of its relation to obesity, I mean, again, they kind of go hand in hand. Um, so the higher amount of like body fat, usually, especially in key organs like our liver, it tends to increase our risk for developing insulin resistance. So that kind of fatty accumulation in our liver will kind of exacerbate the problem. And so we know that definitely plays a role into the development of insulin resistance, which sometimes we don't, see or appreciate. We see a lot of, more the external you know, body fat, but the visceral body fat, the fat that is surrounding our organs, really plays a key role in individuals developing insulin resistance. And again, we know that there's certain populations that are really just genetically predisposed to that. So they might, um, you might have the same, person in terms of body weight, but in the setting of somebody who has a lot of family members that have diabetes, they just really have a higher risk for developing insulin resistance versus somebody who might be the same body weight. So not all individuals that are obese are going to necessarily develop insulin resistance. That makes sense.
Yeah, it does. Thank you so much for explaining that. Let's take our first live caller, Laura. And Laura, please go ahead with your question.
Yes. Hello. How are you?
Hi, Laura.
Good, Laura.
Nice to meet
Thank you
you.
for
I'm
calling.
good.
I have a son that has type 1 diabetes, and he had it for 17 years so far. And I'm an advocate for kids that have type 1 diabetes. I run a lot of Facebook groups, and I wrote to a government task force back in 2018 asking them if we could get a blood sugar test incorporated into well and sick visits so
Mm.
that kids that end up with like strep throat or like some kind of bug that triggers the type 1 diabetes autoimmune attack, that they could get a blood sugar test in the doctor's office. And the task force wrote back to me and told me that there were 80 other things that were on their consideration table to incorporate into the doctor's visit. So in my travels, I've found that doctors and like primary care doctors, they're not really educated on what type 1 diabetes is, and they won't even order the test for the antibody test. And so the people, they end up in the emergency room to be able to get the kids' blood sugars taken. So I was wondering, since you're talking about pediatrics and, the type 2, the pediatrics is really the type 1, okay? It's an epidemic to me. I was wondering what your thoughts are on that.
Yeah, I know. I definitely think that there should be more routine screening, especially in the era of newer kind of immunomodulators that could maybe delay the onset for families or just even prepare families ahead of time. So it's not in such an extreme circumstances where families are often found. I know that part of my role as a physician educator is to make sure that our trainees are aware. I think it's unfortunate sometimes um, when there's not, there's a lack of knowledge from that standpoint, and maybe just generally like family medicine doctors might not have the same training as a pediatrician, or even pediatricians might not pick up on the subtle symptoms. Um, and so routine screening, we do have it for children who are at risk for type 2 diabetes. They have to meet certain risk factors. The American Academy of Pediatrics um, has that as part of their, task force of when to, screen kids for type 2. But unfortunately, they don't have that for type 1 yet. And I know a couple of years ago, there was a big push, to really kind of educate pediatricians that the symptoms of flu or a viral illness can oftentimes look very much like type 1 diabetes. So even just doing something as basic as checking glucose in the urine, if that's all that, a primary care doctor can do, but really the push to screen antibodies, I think more commercially that's becoming more available and there's kind of more awareness and knowledge. But yes, definitely that's definitely something that I'm glad you're an advocate for. Hopefully there's more to come in the next couple of years.
I agree. And thank you so much for that response. And thank you so much, Laura, for that question. Knowing the signs and symptoms of type 1 diabetes is essential, can be life saving. And it is a simple finger stick or even on a dipstick for a urine analysis. And that education is so incredibly important. So thank you for everything that you're doing. We have another question that's coming in live from Mary. Mary, please go ahead. We'd love to hear your question. Hi, Mary. Are you still there?
Yes. Oh, I needed to know if you fry with cholesterol-free vegetable oil, is this still bad for your heart and your weight?
I'm sorry, what was the question again?
If you fry your food with cholesterol-free vegetable oil, is it still bad for your heart and weight?
So if you
Yeah.
sorry, go ahead.
No, Mary was asking, I'm not sure if you heard it. If you fry with vegetable oil, is it harmful for your heart and weight?
If it's cholesterol-free vegetable oil.
Right.
Cholesterol free. Yeah, I mean, I think fats obviously play a huge role in weight. Um, I think it just kind of from uh, a pediatric, again, I'm not an adult doctor, and so I don't, the cutoffs for cholesterol and the recommendations are dietary are very different in children. So in adults, the dietary recommendation for fats, I'm not 100% sure. In pediatrics, depending if there's certain family risk factors, then we do tend to limit. So, like, for example, early heart disease in the family, and or early stroke, then we do tend to make recommendations on ways to lower the amount of cholesterol. I wouldn't say that those are necessarily harmful, but again, the calories that come from fat are much more than the calories that come from certain other foods. So you don't have to do a lot, and you're going to have a high caloric intake. So if you depending on how much you're using, it can really sometimes affect weight. If you're just using small amounts, then it shouldn't be, harmful. But again, if you're cooking and depending on the amount, you're getting more calories per gram than you do with some other foods. So just fats is kind of a category of foods that we have to just be really self-aware of how much we're putting on. I think I explain to families a lot, like when we put dressings on, we have to be really careful with how much we're putting on because even though the packet, at a restaurant um, is a big full packet, if you're eating a salad, that can actually make that salad, 1,000 calories if you use that whole bag of dressing. So I think it's just one of the things that when we start kind of looking into like the category of foods. So to answer your question, no, I don't think it would be harmful. But again, the dietary recommendations are a bit different for adults than for pediatric patients, and there's certain individuals that are higher risk for developing high early heart disease. So it, depending on kind of what your doctor recommends, I kind of base it off of that.
And that was a great response. And just to, again, if people have individual questions around nutrition, because I'm always a proponent of this, ask for a referral to a registered dietitian to help you with your individualized meal plan. It's so helpful, included in most of your insurance plan. So that's really important. And I loved the way that you phrased the question too, because on the bottles of many of these oils, it'll say cholesterol free, but vegetable sourced anything is cholesterol free. Cholesterol, does come from animal sources. And we're looking at different backgrounds of fat, how much fat, saturated fat, et cetera, is included in those products. So really good question. And thank you for that. We have a number of other great live questions coming in. Just as a quick reminder, if you have a question that you'd like to ask live and you're on the phone, please press star 3, that's star 3 on your keypad, and your question will come through so you can ask it live during today's event. And if you're online, then you could submit it in the field below the streaming player. Just remember to hit the submit question button. We have a question coming in from Sandy. Sandy is calling us from Ohio. Sandy, please go ahead with your question.
Hi, I was just wondering if metformin is safe to take, and because I had just heard again yesterday that it's being recalled again. Do you know if it's being recalled, and do you know if it's safe?
That I am not aware of. I know it has been recalled, in the past. It just depends, it really depends on the manufacturer. It's like any kind of regulated product. If there's ever concerns for contamination of the drug, that's always a risk. I think, the Food and Drug Administration, the FDA, has certain standards, and people have to kind of, individual companies have to meet standards. I'm unaware as of yet that doesn't mean that there's not. But usually, what I tend to counsel our families is to call your pharmacy directly and see if the lot that you have is potentially contaminated. Sometimes they'll notify families if they think that you might have gotten it contaminated, but you can always call the pharmacy and see, and they can look up like the lot number of the drug. Generally, metformin is. Oh, I'm sorry.
No, I was going to say that's an excellent suggestion. That's great. Please continue. Sorry.
Yeah, I know, and I mean, actually, metformin is one of the few drugs that we have in pediatrics. So in terms of its safety, obviously, all drugs have side effects. And so, but it's one of the ones that is usually more tolerable. And so, in terms of children with diabetes, we don't have the same options that we do in adults. So, up until just a few years ago, metformin and insulin were our only options. Now, in the era of the GLP-1 drugs, we're starting to expand what we're able to use in children. But metformin has been generally one of the safer options for children with type 2 diabetes.
And metformin's been around a really long time, and you may have been taking it a really long time. My suggestion, in addition to the excellent information that we just heard, is to contact your pharmacy, look at the lot number, contact your physician. Do not stop taking it cold turkey, because if you start it again, you may experience some of the stomach GI upset issues again when you first start taking an initial dosage. So before you go off any medication, it's really important to discuss it with your healthcare provider, your physician, your nurse practitioner, whoever you're working with on the team. And I know that it has been a concern the last time that it was recalled, for sure. So definitely check to see if it's recalled today. In terms of safety, it has been around for a really long time, and there are certain side effects. So do discuss that with your healthcare provider, as you should discuss any concern that you have. Be your own best advocate, and always please make sure to reach out to your doctor or your healthcare provider if you have any of these questions.
Yeah, I
We have
completely agree. We get those questions all the time, and we talk to our families, and then again, I think also reaching out to the pharmacy to see.
right. And you probably appreciate getting those questions, because if you don't hear what's going on with your patients or from their families or their loved ones, you don't know that it's a concern. It's really important to communicate that.
Absolutely. I think, we're our own best advocates. So whenever something, you know, sometimes our families are the first ones that like will notify us of something that just doesn't seem right. And we, investigate a little bit further.
It's great advice. Great advice. We have another question coming in from Adrian, and Adrian is calling us from Florida. Adrian, please go ahead with your call, with your question.
Yes. My question is, can your blood sugar can it damage your kidneys and your liver?
Yeah, so high blood sugars can, it's like a blood vessel disease. And so the blood vessels that feed, small or larger organs all can be affected. Traditionally we talk about the kidneys being affected. The kidneys also have the task of, the job of filtering out high blood sugars. So it's a, very important organ when it comes to diabetes. But honestly, like all your blood vessels can be affected. But we really kind of focus in on, the damage that it can do like to the heart and to the kidney, like the big organs. But I think we don't do as necessarily always like routine screening on just looking at the liver, but I think we do, um, at least in children, do a good job of really looking at liver enzymes. That can also be seen not only with diabetes, but that can be also linked back to obesity. So being you know that can be a risk factor for fat kind of accumulating at the liver, which again can one increase your risk for developing diabetes, but also be a problem with individuals with diabetes.
What functions does the liver perform for the body? And maybe that will help also answer the question of how it is so intertwined with blood sugar management. So I think the question was also based on if blood sugars are not well managed, if they run very high, or if they're not leveled off. Why is that a problem?
Well, so I mean, in general, like the organ, the liver is an organ that really is kind of it kind of helps clean our body. So that's why a lot of drugs, how they're broken down the liver really matters. So um, the I think of the liver as kind of like a clean like a filter, like it cleans our body of toxic things, and then kind of um helps kind of purify, clean our blood. Is a kind of simple way of thinking out of it, but it actually is a really complex organ. It does a lot of other things in terms of storage of fat and energy, and so I think that's a little bit complicated in terms of the full scope in of what it does in terms of insulin and diabetes management.
Yeah, everything is so interconnected and very complex. I'm going to go to one of our online questions, which is coming in from Tabitha. Tabitha asks, what are the best ways to boost your metabolism after the age of 55? I'll give you a crack at that first. What are the best ways to boost your metabolism as we continue to get
So
older at 55?
I don't think I'm qualified to answer that question. I don't really work with that population. I'm, 0 to 18. So there's nothing in terms of recommendations that we generally give our patients to kind of boost your metabolism. I think really kind of basic things, which they seem basic, but they're really important, um, is making sure individuals are getting enough sleep. I think making sure your metabolism is healthy. So making sure that, if you haven't already talked to your doctor about making sure you're getting, blood tests to check like your thyroid levels, because some individuals might be trying their hardest, but, they might have a low thyroid issue, and that can really affect your metabolism. So I think kind of making sure that, in general, you have some of those other blood tests to make sure that you have a healthy metabolism. Um, but specifically like food boosters or I don't think there's like one magic pill or magic trick that we can do. I think just kind of really important basic things is making sure we're eating really healthy, balanced foods. Oh my gosh, I have a spider on me.
No.
uh,
And and
and
and
I think eating like really well balanced meals as basic as that seems, I think that really goes a long way. I one of the things I really try to counsel the families I work with is limiting the amount of added sugar in our foods. I think is a really, really important for our metabolism in terms of regulating blood sugars. Just because high um, glucose loads like from sodas or juices or really kind of cause a huge impact on how our body releases insulin, and that we know is a risk factor for developing insulin resistance as well. So I think to kind of keep a healthy metabolism is to kind of be mindful of how much added sugar is in their foods, which is really hard, because when we eat foods that are not made at home, um, we often don't know how much sugar was added to that. So it's like with sauces or, um, things that we might get at a restaurant, we don't know how much sugar was added to it. And so I think when it comes to our metabolism, um, that's one area that I would really kind of focus in on too is how much added sugar is in your foods.
that's really good advice. And the first thing that you were saying is about sleep. So, as someone who is in the age group of over 55 and as a registered dietitian and a diabetes care and education specialist, I will say this: staying physically active, in addition to, of course, good nutrition, adequate sleep, managing stress to the best of your ability, and having these conversations with your healthcare provider are very important. But physical activity is extremely, extremely important, including aerobic activity, walking, swimming, whatever works for you, biking in that way. Also, strength training and resistance
Mhm.
exercise, being able to make sure that you're maintaining your muscle mass and your bone strength, but that's not it. Also, balance and flexibility are all super important. And making sure that you become your own detective with what you're eating, reading food labels, understanding how to read a food label, and knowing all of what's in the food that you're eating can be super, super helpful. Again, if you want to work with a registered dietitian, I think that's really great, or finding the information that you need through your diabetes care and education specialist can be super helpful. But what may have worked for keeping your metabolism at a really good rate when you were younger changes a little bit as you get older. So it's super important to keep that physical activity and that stress under control, and that physical activity and sleep managed. So just from a personal and professional standpoint, that's a little bit of my advice. Let's go to another live call. And we have a call from Mary, who is calling from New York. Mary, please go ahead with your question.
Oh, hello again. Thank you for today. I have noticed that when my body is being stressed with a cold or some kind of onset of something, my blood sugar really spikes. Could you help explain that process? Why does sugar rise when the body is being stressed?
Yeah, so we see that also in kids. We see that when children with diabetes get ill or sick, their blood sugars tend to run higher. And that is usually the effect of high cortisol levels. So, our stress hormone, cortisol, really plays a role in regulating our blood sugar as well. And so, high cortisol, our normal pattern, usually by the age of 3, we've already established it because we have a sleep wake cycle already. We sleep at night and then we're up during the day. So normally our cortisol levels should only be high in the morning. But when we're sick, when we're under, chronic stress like that, our cortisol levels might stay higher throughout the day just to kind of help our body recover. It's a natural response, but it definitely can affect your blood sugar.
What is cortisol? How do we, is that something that we normally see if somebody went in for a blood workup, let's say for an annual physical? Is cortisol typically something that is looked at or tested on lab work?
No, not routinely. I think most in our world of because I'm also a doctor for children with type 1 diabetes, and so because that is an autoimmune disease, um, low cortisol is something that we do. Oftentimes, we'll check in that population, or if children are coming in with concerns again for early onset obesity, and they have other concerning features, like they're not growing well, we'll check cortisol levels as well. But for adults, as far as my knowledge, is not something that's kind of routinely checked unless there's a specific concern.
We're seeing a lot in adults. We're seeing a big connection now with hypercortisolism, I should say high cortisol levels, and a link with overweight and with type 2 diabetes. And we're finding more and more information about this. So I think that you're going to hear a lot more about this upcoming. And there are a number of publications and information that we'll see coming out through ADA in adults. And this might be something that's more routinely looked at. It's a very interesting topic. We have a call also that's coming in from Susan, who is calling from Los Angeles. Susan, please go ahead with your call, with your question.
Oh, yes. Hi.
Hi.
I got in late, so maybe you answered this question. So I'm sorry if that happens. But since diabetes and thyroid issues seem to go hand in hand, that's something I learned recently. I have problems with hunger issues, even though I try to watch what I eat and balance. I even have another health condition, and I'm taking some medication which does contribute to hunger. But what can I do to fight off hunger? I mean, I do try to balance my diet. I'm definitely active. I walk. I'm always doing something. So, what suggestions do you have?
Yeah, well, one, I would make sure that your thyroid levels are balanced, because if they're not really well regulated, that can definitely, you know, alter your metabolism, which can alter your hunger cues. So that would be, something that I would recommend talk to your healthcare provider to make sure that those are in balance. In terms of, the feeling of hunger, nutrient wise, we know that like protein is really good in helping with satiety. So in our patients, for example, we often kind of recommend like mixed meals. So how you mentioned, kind of balance. But I think just generally as a population, we don't really eat a lot of we tend to put a lot of the starches on our plate, but it's not often balanced well with the fat and the or but we tend to kind of not eat as much protein in the course of a day. And protein is really important with satiety as well. So I think making sure you're getting your dietary recommendations of protein, which are often based on our body size as well. Because we're all, we can't just say 55 across the board. We're gonna eat this amount of protein. There's so many factors that play a role. So I think reaching out to a dietitian to kind of see what your specific goals might be would be helpful.
It's really good advice. And I think sometimes when we believe that what we're eating is balanced, but we're still hungry, getting some suggestions on what might help us with satiety and foods that we enjoy and foods that we might enjoy culturally or that you've eaten in your family for a while. There are ways to balance that into a meal plan. However, for some people, certain foods, whether they're in combination with others or eaten alone, may be spiking your blood sugars that might be affecting your hunger cues, your signals of when you want to eat, and also finding out if something during the day is happening that might be stressful, that's making you eat more or making you eat less. So sometimes it can be helpful, whether you're working on this yourself or you're working with a nutrition professional, to keep a diary, see what you're eating, see what might be triggering your hunger, in addition to, of course, making sure that your thyroid levels are well regulated and that you're taking your medication at the proper time and without food and whatever the recommendations are. But making sure that you are eating as well as you think that you're eating and getting advice around that, just a little small changes can go a long way to big goals and big results. And it can be very frustrating to not be satisfied and then eat something that you didn't even plan on eating, and it not being satisfying and not being the nutritional content that you want. So keep a close eye on what you're doing. Also, I would say, again, it's great that you're doing the physical activity, but making sure that you're getting enough rest and enough sleep is extremely important. We have a number more questions coming in, and let me see if I can do one of the online questions that just came in. We have a good question from Sherry. Sherry asks, are there any side effects to taking both metformin and glipizide for treatment of type 2 diabetes? And she has a second part of that question, which is great and something that we should be addressing. Also, how can you get your doctors to look past your obesity and treat the reason you came in for the appointment, such as a cold or a sore throat? And Sherry, thank you so much for those questions.
So again, I would probably I'm not an adult diabetes doctor, so I actually don't we don't really utilize the glipizide in conjunction with the metformin in pediatrics. That's not a combination we use. Not to say that it's not effective, but I would definitely talk to your you know primary doctor, because sometimes combination of medications can increase your risk for low blood sugar. Um, and so I think that's, a really important conversation to have with your medical provider in terms of drug interactions, especially as I know in the adult world, they tend to use not just one drug, they use a combination of several drugs to treat diabetes, oftentimes to be effective. So I think that's really important, that you're just, making sure your doctor is aware of all of the medications that you may already have been on. Um, or are on. I'm sorry, and the second part of that question.
This is such an important question. How can you get your doctor or your healthcare provider to look past your obesity and treat the reason you came in for the appointment. For example, and we've had this discussion so many times, you go in for a cold or a sore throat or strep throat, and sometimes you're still being addressed based on being overweight or being obese. How can you have that conversation or address that?
Yeah, I think one we as a healthcare team or healthcare providers, we need to do a better job of that. I think we don't train our and I think there's more of an awareness of obesity as a disease, but obviously there has to be a level of readiness for any individual, and some individuals, there's not a concern, and again, not everyone might have that same genetic risk factor for developing complications like type 2 diabetes. um, and again, it's I think as a patient, it's sometimes difficult to um, set that boundary with a healthcare provider. But I think that's really important to kind of advocate for some of the other symptoms. Now, if they are related to, you know, um, weight, but again, I think that's a tough question because I really think it really comes down to the healthcare provider and their training and really understanding an individual's readiness because sometimes and we as pediatricians, they just in the last year released the American Academy of Pediatrics just some guidelines for um, healthcare providers on when and how to talk about this because again, there's not a lot of formal training that goes into this in medical education. And so, an individual's readiness and making sure that individuals and how the healthcare provider is talking about this, is not causing feelings of shame or, um, feeling judged. Because I think that sometimes when, visits are really short and, people are rushing through. And so they might say things in a way that can, maybe not be what your concerns are at the time. So I think we just need to do a better job in terms of healthcare providers and training our trainees, our medical students, and our residents on this.
I would agree. And at the top of today's call, I also made the announcement that today, the Obesity Association, if you go to obesityassociation.org, are just releasing guidelines today about which are going to be part of the standards of care of obesity management. But the first part of this on addressing stigma and bias needs to be shared across the board with anyone that you thought would be helped by this and sharing it. And I hope it gets shared across with all healthcare providers and all healthcare teams. So agree with you. This is a very important topic and one that we should continue to focus on and continue to discuss. So remember to schedule a visit with your healthcare provider, with a healthcare professional to focus on obesity management. And one of the things that we brought up today is to help empower yourself and help to motivate yourself in getting to where you want to go. You may need to make a separate appointment with your healthcare provider or somebody on your healthcare team to discuss concerns you have about if you want to look more into treatment of obesity or weight management. That may require, because of the time that's limited in appointments, a separate appointment. Setting realistic weight goals is one that is important to discuss, not realistic based on just what your healthcare team is saying, but what you believe as well. Learn about treatment options available to you and asking for appropriate referrals, again, to a registered dietitian, nutritionist, physical therapy, physical activity specialists, mental health specialists. So that's extremely important to do as well, because there is a lot of blame, shame, and stigma certainly around this topic for sure. Is there any other key points that we didn't discuss today that you would love our listeners to take home from today's discussion?
Yeah, I'm going to piggyback off of what you said. I think I encourage my patients and their families to write down questions, because that can really help guide the conversation sometimes. And, unfortunately, we're so busy sometimes that we go in with an agenda. um and so it can feel dismissive, but I think if you kind of go in prepared and be like, hey, or like you mentioned, it might require a specific visit just to address the weight, and to the previous caller, be like, okay, I'm here for this, I can set up, if it's such a concern, maybe a separate appointment to discuss this. But I think the big tech takeaways, I think it's more and more being recognized as a disease, and that it can really play a role into risk for other um, you know different health concerns like diabetes. I think that's why there's such a hyper focus on it in, the healthcare world. But that's not true for all individuals. And so I think that is once individuals are ready to have those conversations, I think that's when there's more buy-in, when there's more of a kind of commitment. Okay, well, how do I overcome these barriers, because it's so multifactorial. It might not just be any one thing, and it could be hormonal imbalance, or it could be, just um the activity. There's so many factors that play a role.
Also true. And thank you so much. That was such great advice. Is there anything else that you'd like to add?
Yeah. I think that, yeah.
Very robust discussion. Thank you so much. Again, remember to talk to your doctors and the members of your healthcare team about an obesity focused visit. If that's available to you, please go to diabetes.org/obesity if you'd like more resources and more information. And we'd love you to register for our next event at diabetes.org/experts. Call 1-800-DIABETES, which is 800-342-2383, or email askada@diabetes.org to request a digital copy of How to Thrive resource that can help you on your diabetes journey. These were amazing questions. Thank you for all the questions that you wrote in with and that you called with. We're so sorry if we weren't able to get to all your questions. There were a lot of them during today's Q&A event. You're welcome to contact us at askada@diabetes.org. If you have any other questions, just put Ask the Experts events at the subject line so we know that it's about today. Thriving with Diabetes takes a team, and we're here to support you. A special thanks to our amazing expert, Dr. Escadame, today. My name is Susan Weiner, and on behalf of the ADA team, we want to thank you for joining us today, and we look forward to connecting with you on our future events. There are more coming up. On June 10th at 2 p.m. Eastern Time, Obesity Care, Medications, Technologies, and Tips. And on October 14th at 2 p.m. Eastern Time, Breaking Down Barriers, why advocate for obesity care and how. Register for free at diabetes.org/experts, and please visit our website for more information at diabetes.org/experts and register today. Let's start our very quick and brief survey, which we'd really appreciate everyone taking. It helps us, your feedback helps us enormously shape our future events. So let's start with this very brief survey. Question 1. This event met my expectations today. Question 1. This event met my expectations today. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. Again, question 1. This event met my expectations today. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. If you feel you can use more support in managing your diabetes, check out the diabetes.org website. There are lots of links to information that can help you with your diabetes journey. Ready for question 2? Question 2. I will attend another Ask the Expert event. Question 2. I will attend another Ask the Expert event. For yes, please press 1. For no, press 2. And if you're unsure, please press 3. Question 2. I will attend another Ask the Expert event. For yes, press 1. For no, press 2. And if you're unsure, press 3. Anytime you want more information about obesity management, please visit diabetes.org/obesity. That's diabetes.org/obesity. Question 3. This event improved my knowledge of health education for women and addressing obesity. Question 3. This event improved my knowledge of health education for women and addressing obesity. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. Did you know that there are approximately 38 million people with diabetes? So you are not alone. If you are looking for peer support, the ADA for Peer Support offers peer support through local offices, diabetes camp, online forums, and more. Please check out diabetes.org/community for more information. Moving on to question 4. I intend to use my knowledge I gained from my or my loved one's next appointment with a healthcare professional. I intend to use the knowledge I gained from my or my loved one's next appointment with a healthcare professional. For yes, press 1. For no, press 2. And if you're unsure, press 3. It's important to take practical steps to reduce your risk of heart attack, heart failure, and diabetes risk and kidney disease. Please check out the diabetes.org website to learn more. 2 brief questions left. Let's move on to question 5. Before this event, I felt confident talking about health education for women and addressing obesity to healthcare professionals for myself or my loved ones. For yes, press 1. For no, please press 2. And if you're unsure, please press 3. And finally, question number 6. Question 6. After this event, I feel confident talking about health education for women and addressing obesity to healthcare professionals for myself or my loved ones. For yes, press 1. For no, press 2. And if you're unsure, please press 3. My name is Susan Weiner, and we really sincerely appreciate your time and look forward to engaging with you on a future Ask the Experts event. Please visit diabetes.org/experts to learn more. Thank you so much and have a great rest of your day.